On this episode of Africa Health Chat.
Kama uko na TB, unaweza avoid hadi usiamkishe mwenzako aliye karibu nawe.
Ungabana bali crowded like bacha hosina anything hosipa gore COVID isantse there.
We review the various lifestyle and communicable diseases in Africa.
I went to a diabetic coach. She did some checkups with me. She told me that I had pre-diabetic.
And how the COVID-19 pandemic affected the continent's fight against them. The global pandemic of coronavirus has disproportionately impacted global health, economy, and security. For a lot of people, the COVID-19 restrictions meant increased risk of nutritional deficiencies, excessive weight gain, increased sedentary lifestyle, social isolation, and increased mental health challenges, among others. On today's episode, we will be discussing the effects of COVID-19 on lifestyle and communicable diseases in Africa. I am your host, and I welcome you to Africa Health Check. I am joined by our experts, Dr. Mary Ann Mureithi, the chair of the Department of Medical Microbiology and Immunology, and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achempong, who is a pharmacist and a pastor from Ghana. But before we hear from our experts, let us have a look at this episode's feature story.
I'm Kushan Gobin, 39 years old, living in Rouge, Mauritius, and I'm a technical officer at the Mauritius Housing Company Limited. I went to my doctor. He asked me to do a blood test. Okay. After having done the blood test, he had a look at my results and saw that my sugar levels were a bit high. I went to a diabetic coach at Port Louis, Dr. Samia. Then she did some checkup with me, and she told me that I had pre-diabetic, and she explained to me what measures should I take to counter the effects of pre-diabetic. First of all, I had to cut off all fizzy drinks, Coca-Cola, all these things. And then I had to control all my food intake. I had to consume whole wheat meals, also vegetables, to eat more vegetables, fruits, etc. And most importantly, I started to walk a bit, to do more exercises every day. COVID-19, it was really hard, as you may be aware. It was difficult to, as I'm a vegetarian, it was difficult to get food, to get vegetables, all these things. And it was quite hard to maintain a balance, to have a balanced diet every day, everything. And exercise, it was quite hard because we were not able to go outside, everything. And also I couldn't buy my test kit, my test diabetes tips to do to test my blood sugars, all these things. Advice: exercise, first of all. Secondly, to choose wisely what they eat every day. Try to maintain a good proportion of all the food types to have a balanced diet, and also not to stress out, because it's not the end of the world when you are diagnosed with pre-diabetes. You can still come back to normal if you perform all these exercises, have a balanced diet every day, and be cool. Yeah, it's not the end of the world. Stay positive and maintain a good lifestyle and do exercise regularly.
I believe most of us share the same sentiments that we've had some major lifestyle adjustments and some changes we had to make to our life post-COVID or adjusting to the new normal. And I want to come to my panelists today and maybe take it a little bit at a personal level. Dr. Marianne, what are the major lifestyle adjustments you have had to make over the last 3 years?
Well, the last 3 years have been interesting for my health. Just before COVID, I had started actively to lose weight in terms of exercising, going to the gym and going for long walks. But then COVID hit and the gym got really affected because we had to shut down and we had to be very innovative on how we should keep fit because it was already a part of me. I started keeping fit again because I started wearing a smartwatch, which is telling me, oh, you don't sleep well, I don't sleep deep, I'm not walking as I should. So with the COVID and the gym shut down, I started actively making sure I have walked 10,000 steps. And, it was safe to walk. I'd take my children, go around the neighborhood. And in that process, I started an exercise blog. It's on my Instagram. I gave another name on Instagram so that you had to separate the two types of lives I live, I guess. And I would document my exercises. And my exercises at home would, of course, be long walks. They have a trampoline for the kids, so I'd join them and jump with them for like 30 minutes. And I was very careful what I consumed, what I ate. And actually, I've never felt much fitter than when how I felt during that COVID pandemic, because I was very careful not to lose the momentum.
Yes, absolutely. And I know you are a professional, you are a medical practitioner, you are in academia. What about in terms of you professionally? How had you had to adjust in terms of carrying on your work, but also adhering to the COVID restrictions?
Yeah, that was tough. Because I personally am a social being. I love interacting with people.
Very extroverted.
Yes, I'm extroverted. I'm very passionate about going to class. And some of my classes, I have over 400 students.
Wow.
So imagine, first of all, we're told no class. And then all of a sudden you have to teach on Zoom. I like to watch and see my students' body language. Are you understanding what I'm saying? Because you can tell if the class just gives you a blank look, like, what are you talking about? But now on Zoom, I can't read their faces. I can't interact with them. And I felt, for me, that was very difficult. And when I got feedback from my students as well, that was also very tough because now they're restricted either in their dorms or at home. And there's something about student culture, being together at the university, interacting, going to the library, discussion groups that had been killed. And I have to say that may have accelerated some mental health issues.
Of course.
And again, we're still coming out of that zoning of isolation. It'll take a while, but we quickly also adapted, and I can speak more about the adaptation later on. So COVID really hit me socially. But somehow we zoomed back in.
You managed to cope, and probably you had more time with your family in any case.
Ask my kids the same questions and then answer different one. I was with mommy.
Too much. Mommy was all over our business. Let me just move it to you, Reverend. You are a community leader, you're a practitioner, you're a family man. Maybe just take us through the last 3 years for you at a personal level. How has it been like?
For many people, COVID brought pain, regret, disaster, disruption of normal things. But I look at it on the positive side. And in my case, normally for anyone to say, I'm going to work, meant that you leave the house, drive, breathe the traffic, go spend some hours. But COVID taught us to learn to work from the house. And after COVID, it has become part of my life. So I take it easy. I spend some days at home and I do the same type of work that I would do in the office, which is good. The second thing that I think is benefit out of the crisis is conferencing on Zoom, virtual. Now I can do meetings with my leaders, even teach adult classes at home in the comfort of my in my room on virtual. So it's been good to me on this side, and that has changed my life now.
I mean, you're a pastor, and we believe that pastors, reverends, are among those leaders in community that have to interact physically with people in order to have that effect, in order to have that impact. You pray for people. We even have, I don't know if you have that in your church, pastors lay hands over people. So how was it like having to preach, having to reach out, and even, actually make sure there's an impact in people's lives, and yet you're doing this on the screen?
Yes. Well, people came to accept that, with the national directives, you can't go out, the lockdowns, social distancing. So church members came to understand that my pastor cannot come and physically visit me. So anything on the phone, on social media, on WhatsApp, which actually worked. So this is one of the things that we think has actually improved on our relationship, because for African, if they don't see you, you have not really visited. But it has not come to stay that we can pick a phone and call you. I didn't see you yesterday. Is anything wrong? And it's working. It's enhancing ministry at a different level.
At a different level.
Reverend, I don't know, you can answer me this because I'm also curious. There are people who feel they have not been, their spiritual needs have not been met, they've not been with their pastor who's laid hands on them. So how did you cope with that?
Well, you lead by example. This is what has happened. It's a crisis. It's a pandemic. And this is what science is saying. And it is not in all cases that Jesus laid hands on people and healed them. So when you show empathy with their situations, and then you backed it up with knowledge, in a calm, cool, friendly way. They know you already. So the circumstance, kind of defends you, So that is how we approached it.
So much. And I think there was also, a lot of expectations from the religious community, because we were going through a lot. People were losing their loved ones almost every day. So you had to come forward to console families, to be there for them, and, so many prayer requests, so much expectation that you're supposed to hold communities together in the face of all the confusion, the distress, and the frustration.
Yeah, in fact, during those times, I had to bury two people in my church, but one of them was a leader, and he died. And at that time, there were restrictions as to how many people could gather at the funeral. Went up to 25 people, and it was difficult. But you couldn't do otherwise.
Yes. No, but I believe that the religious community are definitely among the unsung heroes during COVID-19. They really helped a lot of communities, families, and even individuals together. So we really appreciate that. And maybe just quickly to go to you, Dr. Mary, and there's an episode where we're talking about the effects of COVID-19 on non-communicable diseases. And for this episode, I just want us to touch briefly about what have been the indirect as well as the direct effects on communicable diseases.
Yeah, Gigi, that's been one of the things that keeps us awake at night. Also, what's happening to other diseases, because do you know they didn't go anywhere? They're
of course,
yes. But the most interesting thing in the COVID-19, at the height of it, we noticed that gastrointestinal infections such as diarrhea, common colds had gone down. And that was amazing, because we had not seen that before. Diarrhea infections had also gone down. Why? Because people were very vigilant, washing their hands. People were wearing masks. So we kind of cut down those routes of transmission, because a common cold is you need to breathe in the virus through either droplet, airborne droplet. For diarrhea, you're consuming things that are maybe contaminated. You've not washed your hands. So we saw that going down, and that's been brilliant. And I'm here urging the public, can we continue the measures? But also, on the other side of the coin, some diseases also started going up. And these are, can I touch on non-communicable diseases, cancers? We started seeing a long waiting list because now the priority was being given to the COVID-19, people who are more severely infected with COVID-19. They needed to be in the ICU. They needed all the sophisticated equipment to keep them alive. But also you forget there are other people who needed also this equipment, people with heart failures, people who are undergoing very difficult surgeries also need that care. We took away that care from them. And we see some statistics now in the UK, in the US, that they're still analyzing the data. Cancer went up. Cancer rates went up. Cardiovascular rates also went up because, again, of all these factors, we put too much pressure in our healthcare system and neglected some of the other prevalent infections. So these are lessons learned. We need to be very balanced. This is not the first or last pandemic. So I'm hoping that also will shed a light to the non-communicable together with the communicable disease and be very balanced in terms of how we respond to pandemics.
Absolutely. And I think it's just a matter of, taking the lessons that we've learned and saying, how can we make our healthcare system more resilient and better prepared to ensure that the other diseases don't become opportunity costs because of the pandemic. But I want us now, after the break, to jump into what have been the long-term effects on our lifestyle post-COVID-19. But for now, we're going for a quick break and we'll hear what the people on the streets of Africa had to say. Stay tuned.
The government should educate the public more about the benefits of being vaccinated. Because at this moment, I shouldn't say the youth, the population, don't believe the vaccines actually work. Or they actually believe the vaccines are going to bring more complications to them.
So the steps that I take on a personal level is that I do exercise. Almost every day I go for a run, and those are just general exercises that I do. And at least I check on my diet and the things that I eat.
For mothers and children, we need better healthcare facilities and also education for the mothers to improve the health of their kids.
Welcome back to Africa Health Check. We are discussing the effects of COVID-19 on lifestyles and communicable diseases. To come back to you, Dr. Mary, and pick up on what we're just talking about. And I know that there's a lot of research, a lot of studies that are still ongoing because we are just literally sort of out of the woods with COVID-19. So a lot of information will still be available concerning this matter. But so far in the world of science, what has been pointed out as some of the long-term effects of COVID-19 on our lifestyles generally?
Yeah, so there are many ways to look at the long-term effects. Some are still undergoing a lot of research. They're still trying to understand. There are people who had long COVID. So what brought up this long COVID, where they were not able to clear the virus, is something to do with the immune system. We're also looking at other neurological effects. The virus may be lying dormant in some nerves that may be causing some effects that we're still trying to understand. I saw a man who was very fit, got severe COVID, and they've been on a wheelchair up to now. So what happened? We're still trying to understand that because the more we understand, the more we do research, the more we prevent such a sequence of events coming up again. But also, I want to also touch on mental health. We saw a lot of cases of mental health going up. Why? Because of the isolation. Fear of the unknown, the fear alone.
Hysteria as well.
People have been told to not interact. I know of an older couple who really isolated themselves because that's what they were meant to do. But because of cutting human interaction, they've noticed that they're now having slow set dementia. They're forgetting very easily. Memory loss and all, because of that lack of human interaction. So what do we do about that? Maybe it's a lesson learned. Yes, you're advocating, you want to save their lives, save their livelihoods, but also come up with other mechanisms to make sure we are still reaching out to the most vulnerable.
Yes.
Because the most vulnerable at that point were the elderly, people with comorbidities.
Yeah.
But also then we didn't also check the other side of the coin. How are they?
How are they?
Yeah,
Yes.
mentally, socially, physically. Are they also doing some exercise? Because they're already in fear of interaction with anybody. So there's a long-term effects that we need to understand, and then we need to mitigate for future responses.
And as we are readjusting back to normal life, interacting, socializing, do you think it's a good thing or is a bad thing that we've sort of gone back to our old ways? Or should we now be maintaining some of the hygiene standards, some of the ways that, the restrictions that were imposed around, washing your hands, wearing masks, social distancing, but now we're slowly going back to how we used to queue up and be crowded, is that a good thing or is it a bad thing that we're going back to, life before COVID?
Yeah, it's for me, I understand it's human nature. We want to go back to what is normal.
Yes.
But can I now be allowed to call it a new normal?
Yes.
Where we are more vigilant, looking out for each other.
Yeah.
If you have a cold, maybe it's very courteous for you to come in a mask. Don't just turn up in the office. If you have to turn up to the office, come with a mask.
Absolutely.
One
of the things that has been bothering me just at a personal level, and I think I mentally judge people. You remember during COVID, we're encouraged to make sure we cover our mouth when we sneeze or when you're coughing with your arm. But people have gone back to coughing and they're using their hands. They're covering with their hands. And after that, of course, in Africa we use handshake, we hug. So anytime I see somebody who's coughing and they're doing this, in my mind, I'm like, no, So it's just one of those things that we have completely forgotten about, and we've just gone back to our old ways.
I'm calling it a new normal.
Yeah,
we need to change it because we saw it worked. We saw washing hands frequently worked because we had healthier eating.
You didn't have flu for a long time.
Flu, gastrointestinal infections that down. So I really want to urge anyone listening. We can adapt because we're humans. We can do it.
Yeah.
Let's continue those good public health measures.
Yes, and practice
because we're looking out for each other.
Absolutely. That's really good advice, Reverend. One of the biggest challenges to our lifestyle during COVID-19 is that we saw an increase in unhealthy habits, unbalanced diets, inactivity, addiction, and so many other unhealthy habits that we sort of picked up as a coping mechanism. How do we help society as public health practitioners, as leaders? How do we help people who are still struggling to come out of those bad habits?
Well, we need to understand that's where health literacy is important, to let people understand that when you talk about health, it's not just a one thing, it's a whole multidisciplinary issues. Sedentary living is a great hazard to people's health. So COVID came, lockdown, stay at home, 1 week, 2 weeks, 3 weeks, 2 months, and then you have taken that as the new normal. You are in actual fact putting your life at risk. I lost one of our leaders, diabetic coma. He was diabetic, and it was during this period, and we were talking about the effects of COVID on communicable and non-communicable diseases. This is a non-communicable disease, diabetes. Diabetes rests on constant checking of your blood sugar, being careful about your diet, and then being active. So during this time, no one knows what actually happened. Probably he was afraid to go out. He was afraid to, maybe his drugs, ran out, and he didn't want to go out to purchase any, and he died. So if someone is using those times, restrictive times, as the new normal, health-wise, it's not. You ate whatever was available then. You cannot continue to do that. You didn't go anywhere, no games, no friends, no social life. You stayed at no church, because your church will feed you through the virtual and things like that, and you continue to do that. It's not healthy for you either. You're a social being. It was a crisis time. Now it's over. Go back to your African roots, communal living, interaction, visit with family, have a nice time.
Enjoy life.
Enjoy life. So there is a good side to it and there is a bad side to it.
Absolutely. Maybe just as a parting shot, Dr. Mary, and just a word of advice to people who, rightfully so, are still going through the trauma of the effects of COVID-19. Some people actually are terrified of going out because they've lost their loved ones. They have actually seen COVID hit very close to home, So for them, they're still living in that trauma that, had my mom not gone out, she might still be alive. Had my dad not gone to the shopping mall, he might still be alive. So what do you say to them to help them readjust and just come back into society and live their life?
Even to add to that, I have friends who got COVID, went to visit their mom or dad. The mom or dad got the COVID and the parents attached to it. So there's also that trauma of, it was my fault.
The guilt.
The guilt and all. So if you out there listening to this, you're going through this experience, you're feeling traumatized, you're feeling guilty, it's okay. It's okay to feel all those emotions. And it's okay to seek help. And nowadays, you can seek help from many portals. There are counselors. And I'm hoping in the Africa Health Check, we can start up that momentum of it's okay not to be okay, so that people can seek help. You can see your spiritual leader as well. Just talking about it is a good start of healing. And then from there, pick yourself up. Self-care is important. Maybe go for that walk. It doesn't have to be very far. But the more you walk, the more you release those good feel hormones, the endorphins. And it becomes part of your lifestyle. Eat well, enjoy life. And for me, my motto is always live a day at a time.
Take it one day at a time.
A day at a time. Look after yourself, and all will be well. All will be well because we are resilient. We are a very resilient community, society, and that resiliency comes from our oneness.
That's right.
Yeah. So also, be your brother's keeper. Watch out for your neighbor. Have you seen them in a while? Have you checked up on them? So let's do that. And trust me, Gigi, in the next few months, years, we'll be such a resilient community that not any other pandemic will put us down. That's my confidence.
Wonderful. I guess, Reverend, you may say amen to that.
Amen.
Thank you very much for that. Really, really profound. I think the key message from this episode is that it's okay to not be okay. We are adjusting, we are learning to live with the new normal, and it's okay to have good days and bad days, but remember not to isolate yourself. Do reach out for help, do reach out to anybody you're comfortable talking to, and try to make sure that you take each day at a time. You will definitely get there. Before we wrap up the show today, I would like to take a look at our African Health Champion for this episode, and that is Professor Omu Anzala, who is a medical microbiologist at the University of Nairobi in Kenya. Let's have a look.
Professor Omu Anzala is a distinguished Africa Health Champion known for his contributions to medical research and public health, specifically in HIV vaccine investigation. He co-founded the Kenya AIDS Vaccine Initiative, KAVI, and has led numerous HIV vaccine trials. His work also explores genetic and immunological factors in HIV-infected individuals. Professor Anzala has authored over 91 peer-reviewed publications and mentored numerous students. Overall, Professor Anzala's expertise and dedication have greatly impacted medical research and public health in Kenya and beyond.
And that brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight right here. Follow us on Facebook, Twitter, YouTube, LinkedIn, and Instagram. The handle is @Africa Health Check. Until we meet again, same time, same place, same date, remember the future is Africa, the future is today.